Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Hi team, and welcome to the MMOA podcast brought to you by the Institute of Clinical Excellence. I'm Dr. Samantha Chamberlain, and I just wanted to hop on here tonight and talk about an article that I read recently. I did something completely wild, and I looked at the FSBPT email that I got for the October news brief is what the subject line was. And then I opened it. I did that crazy thing where I opened an email, and I scrolled through it, and down at the bottom, there's a section called In the News, and there were some article titles that caught my eye, and so I kind of scrolled through some of them, opened a few of them. I even clicked on stuff within an email. I know it's wild. But in that section, there were several really interesting articles. And one of them was from the John Hartford Foundation and AgeWave. And I hadn't heard of either one of these things. So it, sent me on this trail of information. And there was the link on there took you to this page. And then there was this full report. And the full report is called Meeting the Growing Demand for Age-Friendly Care, Healthcare at the Crossroads. And in it, there's several really interesting topics, but there's one section that has the 5 forces disrupting / transforming healthcare today. And I read through this, and all of them are stuff that I have thought of, stuff that I was like, does anyone else recognize this? I know a lot of people within this crew do. I just don't know if people in bigger organizations, within hospital systems, within all that stuff, are trying to do anything about it. So I really wanted to basically kind of do an article review. Maybe this is a article audible moment, because I'm gonna read through this first section so you can kind of get the full picture. I really thought about summarizing it, but there's so many really powerful statistics in here, and really powerful, and it's really short. So I'm gonna read it, and then I'm gonna give some action items that can be done on this as far as what you can do within your community with this information. So point 1 of the 5 forces, or force 1, if you will, was the age wave, a dramatic demographic shift. And it says, America is aging rapidly. Those aged 65 and older are the fastest growing segment of the population. From 2025, which, by the way, is next year. I know, I was thinking about this earlier, talking with a patient about it, and I was like, 2025? Wait, 2025 is not 5 or 10 years away. It is in a couple months. So 2025 to 2050, the number of adults 65 and over will increase by 30%, from 63 million to 82 million people, accounting for nearly 1/4, 23% of the population by mid-century. The oldest old ranks are growing even faster. The number of adults aged 85 and older is projected more than double between 2025 and 2050, from 7 million to 17 million. This older American population is also growing more diverse. While 75% of today's older adults 65 plus are non-Hispanic white, that percentage will shrink to 60% by 2050. We are crossing noticeable watersheds. By 2034, there will be more Americans aged 65 and older than under 18. More older adults than children for the first time. Already today, among working adults, there are more caregivers of older adults, approximately 22.8 million, than parents of young children 5 and under, which is estimated at 21 million. But this increase in caregivers will not be adequate for the impending caregiver shortage. So that's one of those points that we need to kind of touch on, the caregiver shortage. So we have this really fast growing population and not enough people to help care for them. And there's ways we can kind of navigate that. Going on, the massive size of the baby boom generation, all of whom will be 60 and older by the end of this year, accelerates this aging trend. And boomers' attitudes, including a willingness to experiment and change the rules, have reshaped each stage of life they've inhabited. More than ever, today's older adults appreciate their potential longevity and want to make the most of it. Most think that their later years not merely as a time of rest and relaxation, but as a new chapter in life with new ambitions, hopes, and dreams. If you've been around the MOA crew, you know we're all about hope dealing, so we are right on board with this. They know that good health is their number one asset and key to achieving their dreams. More than previous generations, boomers seek to own their health and actively manage their relationships with healthcare providers. Society and its institutions have not responded adequately to this age shift, creating challenges for their operations and the people they serve. These major challenges include stress on Social Security and public sector pensions as the ratio of contributors to beneficiaries has declined dramatically, Medicare and Medicaid to maintain service solvency, employers, including in the healthcare sector, as they face retirement waves and labor and experience shortages, families as more older adults need care and fewer adult children are on hand to support them, social services such as housing and transportation that support older adults, and every aspect of healthcare and clinical services. We have not adequately prepared for this as a society. The growing older population makes it imperative that the healthcare system increase its capacity and capabilities. Older adults already utilize a large share of healthcare services. The 17% of adults age 65 and over account for 43% of hospital admissions, 36% of doctor office visits, and 37% of total healthcare spending. The average annual per capita care spent on those 65 and over is $22,000, which is almost 3.5 times the average spent on adults age 18 to 64. So just to reiterate that, the current older adult population is 17% of our total population, and they account for 43% of our hospital spending and 37% of our total healthcare spending. In 2023, Medicare expenditures were $1 trillion, actually over $1 trillion. By 2036, 12 years away, the Medicare Board of Trustees predicts that the Medicare Hospital Insurance Trust Fund that pays for inpatient hospital stays, such as hospice and other types of care under the Medicare Part A, will be depleted, while expenses for other parts of Medicare will grow significantly. The trustees' report calls on policymakers to address Medicare's financial challenges. Without action, the health and quality of care for older adults will suffer. Demographic pressure on the healthcare system is inevitable. More older adults will need much more health and long-term care services. The system must reorient its skills, services, and technologies around meeting those needs. The 4 other forces suggest how, and we'll get to those in different podcasts. But I wanted to really point that out. And then there's a quote over here to the side. We need to embrace aging as a normal part of life and do all we can to keep seniors healthy and active, strong, mobile, cognitively sharp, and able to be independent. It's not just independence to help them. That's a quote by Angela Patterson. She's Vice President and Chief Nurse Practitioner Officer at CVS Health and Minute Clinics. But it's not only just independence because that person wants to age in place, so to speak. It's also independence because our system is not set up to support a lack of independence for these people, or a lack of being able to do most things independently. I've heard a term interdependence over the summer, and I just love that because we need support from each other. We always hear it takes a tribe to raise a child. Well, I think it just takes the tribe to care for each other at any age. As a kid, yeah, we need more support because, you don't know how to life yet, really. I mean, breathe and, the basics, but you get what I'm saying. And then as in the middle person, like between my grandparents, my parents, and my children, trying to help everybody, like there's plenty of times when I need help. There's times when my parents need help. Like there's all these different types of help we need at different phases in life. So it's not that we want to keep them socially isolated, independent, but we need to be able to keep them healthy and independent in a way that they don't become such a stressor. We as older adults, when we get to that point, don't become such a stressor on society that our quality of care is completely awful, right? So a couple of things I wanted to point out here. Why do we think that 43% of our hospital admissions are older adults? Yes, we know that there's physiological changes as we age. Sorry, the wind in Oklahoma has been stereotypical, which is not like it usually is in my part of Oklahoma. And it's been excessively dry, like super bad drought, like over a month with 0 rain, which is really weird for us. So it's getting to me. Anyway, But many of my patients have said that they've put off healthcare or put off different procedures or put off different preventative care until they were on Medicare because they knew it would be paid for. So it's like, are some of these costs because we're not taking care of ourselves before because of the cost of healthcare, and we just got to kind of waiting until that Medicare age hits, and then we're like, all right, how many of these things can we get done? I've had more than a few patients that have verbalized that, have expressed that. Like, I've had them before they were Medicare age, and then I've had them, they're like, oh, I'm going to have this, and this test done because Medicare kicked in. And I've had the people that have, been on Medicare all that I've known them, and they also have similar stories to where it's not necessarily these things just randomly start happening at age 65 and over. It's that they have been kind of limping along, so to speak, until they got to that age because it was going to be financially easier for them. So this is where the action items come in. What can we do to help individuals before they're 65 not need so much health care when they're older adults? And I think a lot of that comes into preventative care. It comes into not waiting until we're sick, not waiting until we're injured to seek help. It comes with advocating for exercise. It comes with advocating for socialization programs, like, going to the senior center and playing cards, or really cool thing at our local senior center, some high schoolers volunteered during the summer, and they would bring their Nintendo, and they would do like Nintendo bowling, and they would do all these different things, but it was keeping them active, and it was creating those intergenerational relationships. So it was really beneficial on both accounts. They were being active, but they were also getting some different type of social interaction, which is important for our health. But 3 other things I want to address. They mentioned the caregiver shortage. So I feel like every branch of healthcare has a high level of burnout. And I felt that way within my first year of being a PT. What really changed it for me, honestly, was taking ICE courses and feeling like I actually knew what I was doing, what PT and OT and the rehab profession was capable of, and seeing it put into action. And so being able to find that joy. But what typically I hear people say is really causing the burnout is all the paperwork and the hoops to jump through just to get things that people need, and advocating for people and making sure that people are taken care of. But it gets exhausting when you're the one doing all the care. So I highly encourage people to take care of yourself. So make sure that you are advocating for your own health. Make sure that you are setting, at least 3 times a week doing some kind of physical activity, preferably go for walks after dinner with your family, make time for yourself, make time for your health, and make time to make sure that you're drinking water throughout the day. Just all those basic healthcare things that we know, but we tend to get in the weeds of caring for others and forget to do it for ourselves. So we become a little bit hypocritical in our advice to people. So really prioritize making sure that you're healthy, that lead from the front mentality, that practice what you preach, all of that. And then find what you enjoy most about your job. Like, what's the favorite part of your day at your job? And really try to hone in on that part of your day. I know it's a lot easier said than done, but when you think about the impact that you're having on people and how much that the knowledge that you take for granted that you are able to convey to them, even if it's about their sleep or their nutrition, or hey, even just getting up and going for a walk after you eat can reduce your risk of diabetes or reduce these chronic diseases. Like, there's so many little tidbits that we have to offer people that you can really make an impact in their life. So find that joy, like whatever it is that you enjoy about your time with patients, really highlight that part of your day. Like, just being thankful for that opportunity. And then also, what do you like least about your job? Typically it's notes. So in that case, change your programming. Typically notes are hard because you're typing out a bunch of stuff or you're putting too much in your assessment. Like, notes don't have to be as long as what we think they do. They need to tell what the patient did, what they struggled with, and why it's necessary. Like what part of that visit was important to them, how'd they do with it, why do they still need your services? Keep it short and sweet. It doesn't have to be drawn out. On your programming, if you're doing a warm-up and then a circuit and then maybe a finisher or, a cool down, my circuits are 4 or 5 exercises. We repeat them 2 or 3 times, kind of like we'll do EMOMs, we'll do rounds for times, we'll do AMRAPs. We'll do all those things that you've probably heard from us in any of our ICE courses. And it makes notes so much easier. You're not scanning through this big long flow chart. You're not trying to decipher what all exercises you did last time. You're not looking at a long list. It's very concise. And, sometimes my assessment is within my list there because I'll, I had a cue for this, or they couldn't tolerate this as well today, or we had to reduce this, or we were able to bump up this, and it's just right there within my, what we did that day section. So don't be afraid to really shorten things down and still provide a really potent therapy program. It's easier for you, it's easier for them, and it really helps with that burnout of not wanting to do documentation. And then the third, it talks about these like social institutions that we have, like the transportation, housing, employers, things like that. They aren't easily accessible for a lot of older adults. So we want to make sure that we're finding ways to advocate for those things within our communities, trying to help teach patients how to navigate bus steps when they have a hurt, whatever. Like maybe they've recently had a hip replacement, or they have an ankle injury or something like that. You can teach them one step at a time. You can teach them, a lot of individuals that I've treated, when they have a hip injury, they're doing the sideways step up it, but not everyone figures that out as an option. Of course, we want to navigate past that, but those bus steps are big. So if we can help them be able to compensate while they recover and still get around within their community, that's going to be very beneficial to them. So make sure that their needs are being met from a public, transportation, housing, what does your community have to offer? Find those resources and help share them with the individuals that may need them, that may not know they exist. Again, our local senior center has some volunteers, some older adult volunteers that deliver meals to the people that can't get out as well. So they have meals every day at 11, and some of those get packed up and taken to different people. And maybe it's people that are just kind of on the schedule. Sometimes it's after someone's had an injury that normally comes in, they'll check and see if they need meals delivered. And so they they're on a rotating schedule, so it's a different volunteer each day of the week, but that's their day each week. So find those programs. I did not know that they existed in my community until I started looking for them and talking to people and searching for those things. So you might be surprised what you have that you don't realize you have available. And then the other part was Medicare Part A being depleted in the next 11 years or so. And that's the part where we as rehab professionals can really play a huge role in reducing healthcare costs. If we can teach people how to fall safely, if we can teach people how to get up off the floor independently, if we can teach people, how to take care of themselves in a more preventative type way, in a more health care instead of sick care focused way, then we really have a chance of bringing down this $1 trillion cost, because people won't be going to the hospital as much, because they won't be breaking their arms, because they're not going to FOOSH, because they're going to use those principles that we teach within the MMOA courses to roll and to get low and to do all these things that really help prevent some of these hospitalizations. We're going to teach people how to improve their sleep, what sleep hygiene looks like, whatever needs to be addressed for them to have these reduced hospitalizations. That's what we want to be able to do for them. So I think that rehab professionals in general and fitness professionals in general have this really potent role right now. And I think, especially with more information like this coming out about how, I don't want to say bleak, but our healthcare system is not doing well. And with this kind of exponential growth going into the next 25 years, something has to give. And I really think it's reducing chronic disease, reducing the onset of cancers, reducing this. And we have so much research now backing up that moving your body, not being sedentary, is what's going to do that. So if we can teach people, and if we can host, what do I mean by teaching people this? I don't just mean the patients that come in to see you. I mean trying to host fall prevention, fall preparedness, community, drawing a blank, like just community workshops, sorry. But drawing those community workshops and getting people involved and utilizing your local Y, utilizing your senior center where those people are already going, and having them, team up with them to advertise for it. I teamed up with our local Y. I did a fall preparedness workshop. It was actually how to fall, and I had a few people come up to me and they're like, what do you mean how to fall? Like, I can fall just fine. Well, they thought they could. They said, I read that flyer and I thought to myself, I know how to fall, I don't know how to get up. But we went through the different motions of falling and how to get low and then roll, or, try to land on larger surfaces and reduce that impact. And they're like, that is so helpful. So it doesn't have to be every month, once a quarter or twice a year or something like that. Still has a big impact when you team up with some of those places it was packed. I shared some stuff on Facebook, but the local Y did a lot of the work for me because they were, sharing it with their members and with people within the community. And so I just got to come in to a packed room and talk about it and kind of work through some of those situations and then how to get up from the floor. And I had a lot of people come talk to me afterwards. So don't be surprised if you can do a few of these and really benefit your community by teaching them these things and helping them. You get a little bit of pushback, of course, from those people that are like, oh, there's no way I could do that, when you start showing them floor transfers and stuff like that. But it gets them thinking. Those are usually the ones that ask a lot of questions. They're quick to be like, there's no way I can do that. But then you start talking through stuff individually, and it just really helps them to know that all hope isn't lost. You become that hope dealer right then and there, that there might be ways for them to get stronger. And then that's the next thing, like, how do we get more people into those local gyms, into those programs, and can you host, do you have the space or the connection to host an older adult fitness class a couple of times a week? So any way that you can be in the community teaching these things and helping people understand that chronic disease doesn't have to correlate with being older, or that just because you're older means that you're going to decline. Like, if we can really start getting that out there within each of our communities individually, then I think this is going to help this Medicare cost start to reduce. Well, I say start to reduce. The aging is going to go up, but if we can just hold it steady even, I think that would be really, speaking to what we can do. So I think our healthcare system will really start leaning on rehab professionals more, fitness professionals more, really valuing what we can bring to the table as far as reducing these hospitalizations, getting people's heart health improved by, teaching them about zone 2 training, teaching them about high intensity interval training and the impact that it can have on diabetes, on chronic heart disease, on so many of these things that we are fighting with all of our patients, with high blood pressure, with, the list goes on. But I think that can be our role with this first section of our healthcare system and being at a crossroads with our aging population. Love to keep this discussion going. This is going to be a 5-part podcast. There'll be some time in between. Part 2 is going to be health span, lifespan gap. I almost jumped right to that because I've been on a health span kick, and I just find it really interesting and love this health span term compared to lifespan. And it, this kind of goes into it briefly, just like what we did about the other one. But that's up next. If you want to catch the Modern Management of the Older Adult live crew, there's going to be a class in Mineola, New York this weekend. Might be a little too late to sign up. You might be able to squeeze in. It's November 2nd. November 7th is going to be in Loveland, Ohio. January 18th, we're going to be in Hendersonville, Tennessee. And January 25th, we'll be in Athol, Idaho. L1 is currently up and running. We're in our second week of level 1 for the online course, but the next one starts January 8th, and level 2 will start January 9th. So jump into any of those courses. We'd be happy to see you, and we look forward to hearing more.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.